Subject SNPG 939 Assessment 3. I am going to present on the poster regarding harm reduction, which is one of the most important pillar of harm minimization. According to the National Drug Strategy 2017, harm reduction strategies recognize as that for every risky behavior, there is a range of choices from the most to least harmful. Harm reduction campaigns aim to provide accurate information and safe or alternative behaviors to reduce harm. Likewise, according to the Harm Reduction Australia, harm reduction is the policies, programs, and practices that aim to reduce the harms associated with the use of psychoactive drugs in people or people who are unable or unwilling to stop. So I found there is a research about the data of deaths in the Australia by the overdose of drugs. It said that more than 1,000 people die from opioid overdoses every year in Australia. So to reduce this harm reduction program in Australia has been launched, which is in the first state of Victoria, Australia, 2017 to 2020 needle and syringe program, peer education, medically supervised injecting facilities, overdose training programs, and pill testing. And then talking about needle and syringe program, we can say that it is one of the successful example of harm reduction program. It includes positive changes in injecting practices, includes less reuse of syringes, includes use of sterile water, cleaning of injection sites, and syringe dispensing units, which directly prevents in transmission of bloodborne viruses like HIV/AIDS and hepatitis B and C. By establishing needle and syringe program, all contributed to our low infection rates that have saved millions of dollars of Australia. So next I'm going to talk about the popular harm reduction strategy, which involves the preventing drink driving and reducing the accidents caused by drinking alcohol. The programs and intervention to prevent risky driving approaches to promote licensing of liquor, responsible alcohol service, information and education program, community-based approaches are intended to minimize the public violence caused by alcohol consumption. Regarding tobacco harm reduction interventions on banning smoking at workplaces and closed public places. Another thing is about the pill testing is a harm reduction service that analyzes the content of drug to help you to avoid the unknown and potentially dangerous substances in illicit drugs. And this data shows from pill testing can contribute to an enhanced monitoring of substances and increase the effectiveness of government's response by providing them with the accurate knowledge from which to create warning campaigns around new potentially lethal substances, as well as about talking about overdose training program. According to the Alcohol and Drug Foundation, there is a need of drug overdose training programs like naloxone can be administered by medical professionals such as paramedics, by friends, family, bystanders who might be responding to an overdose. Best practices is to be provide appropriate training to those who administer naloxone so that immediate action may save lives of people. Similarly, according to the Star Health Victoria, also launched the different programs like mobile health outreach services and overdose prevention and response. National Institute of Drug Use 2015 also launched the different program about chill out and sanctuary space. Harm reduction strategies at music events are numerous and diverse. They range from the provision of water stations and free water bottles at events to providing pass outs or chill out and sanctuary spaces. The more that is done to address harm reduction at events, the more successful the outcomes are effective. And health and first aid provider has been given. In this way, the harm reduction will help to harm minimization. Thank you.